A very good evening to one and all. I hope you all are doing fine. We will start with the next topic, that is palliative care. And also precisely we would be discussing what is the role of us dentists in the field of palliative care. So to understand the topic better, we start with the definition of palliative care. It is defined as the active total care of the patients whose disease is not responding to curative treatment. That is, it offers holistic, compassionate care to people living with progressive, incurable illness. It is actually about providing care. There you are trying to relieve the patient's symptoms or provide relief from pain, but you are not curing the disease in any way. That's why I said earlier, it offers holistic as well as compassionate care to these patients. So what exactly is palliative care? It's a specialized medical care for patients with serious illness. What are its aims? Its aim is to improve the quality of life and also to minimize unwanted suffering for the patients. Initially or historically, it is considered as a service for the cancer patients alone. But now times have changed. Other chronic and incurable diseases like AIDS or say Alzheimer's disease, all these patients are also provided palliative care. So looking at the history, where did it start? Madam Dame Cicely Saunders was one of the pioneers in the field of palliative care. She had the vision for the approach of palliative care. She was a physician, she was a social worker, she was from England. She brought in the concept of palliative care for the first time, and she had this vision of providing care for the patient. That is, she wanted to have somebody to have a good death, not suffer too much. So that was the basis or the foundation on which she brought the concept of palliative care. So where she wanted to make sure end of life situation for the patients were smooth, also give feeling of self-confidence and dignity to these patients. Currently, the healthcare approaches are mainly discussed under these following headings, starting with the preventive care, curative care, restorative, and the last one, that is the palliative care that we are currently discussing. Preventive care or the primary care, that involves changing lifestyle habits. That is, you are trying to bring in, educate the patients and trying to improve their general health. Second is curative care, where the disease has occurred, where you then try medicines or some other form of treatment where you try to modify the disease. The third one is the restorative or the tertiary care, where there is focus on restoring the function of the patient. The fourth one, that is the last one for us and the important one, that is palliative care, that is relieving the suffering of the patients and also trying to improve their general quality of life. So what are the goals of a primary palliative care approach? It involves integrating the psychological and spiritual aspects of patient care, support system for the patients, support system for the family, use a team approach to address the needs of patients and their families, enhance quality of life. The role of the palliative care, as I told you earlier, is neither to hasten nor to postpone death. They consider patient as normal and they treat the patients for or provide relief from pain and also from distressing symptoms. So the team of palliative care has a multi-function role in providing care to the patients. So where can you get access to palliative care? It can be based in hospitals where you can visit or get access to palliative care on an inpatient or an outpatient basis. The second is community or home-based palliative care, where the service care providers would visit the individual households and provide some kind of or some form of care. The third one is the hospice care. It's a specialized type of healthcare which mainly focuses on palliatively or terminally ill patients who require palliative care, and also making sure their emotional and spiritual needs are also met. So let's see who would all constitute the team of palliative care for both the patient as well as for the family, providing them with physical, psychological, spiritual and social support. It would involve physicians, spiritual counselors, social workers, pharmacists, home health aides, therapists, nurse, etc. These are main members of a palliative care team. Let's now look at the current scenario in India with respect to palliative care. The history of palliative care in India dates back to 1986 in Mumbai, where the first modern hospice care was established. It was named as Shanti Avedana Sadan. In 1975, the Government of India initiated a national cancer control program with a provision for palliative care, which was also Indian Association of Palliative Care, which is the premier organization with most of the registered palliative organization locally are affiliated to. It was a registered organization from the year 1994. In April 2008, Kerala became the first state in India to announce a palliative care policy as part of healthcare. India does not have a national policy on palliative care in spite of giving lot of support and recommendations to be included in the national health policy. Currently, there are 138 organizations who are providing palliative care services across 16 states. These services are usually concentrated in large cities and affiliated to regional cancer centers, with the exception of Kerala. In Kerala, they have the highest number of palliative care services or providers. The Kerala network has more than 60 units covering a population of greater than 12 million and is one of the largest networks in the world. Our own Perinthalmanna has a pain and palliative care society to which our students are a part of, where they go on home visits. I don't know whether you all have been a part of it, but then our interns and final year students have been a part of this support care. Calicut Model WHO Demonstration Project. This was one model that was initiated by the Pain and Palliative Care Society in Calicut, who developed a flexible, low-cost palliative care model which could be implemented anywhere in the world, especially targeting the developing world. So this model was approved by the World Health Organization and has been a model for all other countries. WHO recommended 3 foundation measures for developing palliative care. One is governmental policy, second is education, training and research, the third one is drug availability. According to WHO, these 3 elements are very crucial to running a successful palliative care model that includes support from the government in form of policy as well as financial support. Also important is for these team members or professionals who are in palliative care approach to be educated, to be trained in the recent updates in providing care, and also to make sure that drug availability is made sure for these palliative care models so that they could provide relief from symptoms. Or let's look at some obstacles or barriers for implementing palliative care approach in India. Starting with population density, that is, India being such a large country, vast spread, 130 crore population, it becomes really difficult for palliative care to reach every one of them. That is one reason. The second being workforce development. As I told you earlier, it requires a team-based approach. You need nurses, you need volunteers, you need therapists, you need physicians to work at the base level for palliative care, which is not available in India because of the lack of support and funds. Second is limited national palliative care policy. In India's health policy, there is no mention of palliative care, in spite of submissions from the Palliative Care Society to the government in trying to ask them to include them in the health policy, which has not been done till date. Second is lack of institutional interest in palliative care. As this is more of a social service approach, most of the private institutions are not interested in the palliative care schemes. These are the main reasons or obstacles in implementing primary palliative care. Poverty in India is also a reason for the lack of success of palliative care approach. Good and effective communication is very crucial in today's world, especially for patients who needs to be informed. When communicating with the patient, if you are not to the point, it is either effective or ineffective. It may not reach the patient. It can also be stress inducing for the patient. Also at the same time, you can relieve him of the stress if you can communicate well with your. So let's look at some key tips in effective communication between the patient and the service care provider. How does it help? Greeting and seating. How close you sit to the patient, you wish him, say good morning, welcome the patient. You encourage him to talk during the entire period that you are with him. Also making sure that you have an eye contact with the patient when you are conversing with him or her. Tolerate brief silence in between where the patient would not be talking or may go into a silent mode. The other communication technique would also involve making sure that there is no interruption in the communication. That is, there is no stoppage where you don't try to break the conversation. It is also about being a patient listener. You are listening to every single word that comes out of the patient's mouth, listening to every single word. It is also being sympathetic and also being sensitive to the patient. At the same time, making sure that you are only giving realistic hopes and not being unrealistic, and also trying to follow all the ethical guidelines that needs to be followed between the doctor and the patient.